Like many hospitals nationwide, Henry Ford is hiring.
This went down about 155.
The U.S. Department of Health and Human Services expects a nationwide nursing shortage will intensify over the next decade, projecting Washington, Georgia, California, Oregon, and Michigan will have the largest deficits. Chief Nursing Officer Eric Wallace says Henry Ford is down about 1,100 nurses.
There is a serious nursing shortage right now in the United States, and some are saying that the immigration crackdown is going to make the situation worse. But on the other hand, the nurses are saying the hospitals are the problem. It's not immigration or anything. It is the hospitals who are causing people to walk out of nursing profession. In this video, we're going to be looking at two sides. We're going to be looking at the hospital CEOs and why they think that the immigration crackdown is going to make the situation worse. And we're going to be looking at some nurses and why they want to walk away. Now, enough talking. Let's just get back to the video.
This is not new for the nursing workforce, but definitely something that I think we're more focused on now coming out of the pandemic, because we saw a lot of nurses who were able to step out of the workforce, retire, move on. So we've got lots of things that we're working on to try to figure out how do we start to fill that gap.
One of those things is recruiting internationally.
One of those things is recruiting internationally.
In addition to the hundreds of hospital workers who cross the Detroit River every day from Canada, Henry Ford also hires from the Philippines. Why the Philippines?
The Philippines is a great place for a number of reasons. One is, and probably first and foremost, is they train their nurses very similarly to the way that we do here.
It's a relationship that goes back generations, with Filipinos today making up 1% of the U.S. population and 4% of the nation's nursing workforce.
How was your night?
For nurses like Felice Abad, the opportunity was in the profession itself. She was a nurse in the Philippines when she had a patient with abdominal bleeding.
Okay, so I just had to pause it right there because you're already seeing the link between nursing and immigration. So many immigrants, like I'm an immigrant myself, I'm an African immigrant, and many immigrants, like many nurses, come from the Philippines. That's like, I think, majority immigrant nurses are Filipino. And then you also have a lot of African immigrants and several other immigrants who choose nursing. The reason for choosing nursing, for me, I did not do nursing, but I considered it as an option because you could do like 1 year schooling and become an LPN. Many people start as CNAs and then they go LPN and then you go RN. And then you just keep on going until you get your bachelor's. But for most people, like, it's an option because you go instead of starting work at at a fast food or whatever, you can just go do nursing LPN maybe 1 year, and then you can start earning $20 plus per hour. Now the hospital in this case, they are afraid that this Trump crackdown, immigration crackdown, is going to affect their ability to hire the nurses from Philippines and other countries because it's an immigration issue also. Now, is it really the reality? Is there a real shortage of nurses, or it's just the hospital CEOs being greedy and wanting to pay lower wages and staffing issues? We will see that, but let's go back to the video like a few minutes and then we go to another video.
Fix was textbook, but one her rural hospital could not provide.
We couldn't do anything. There's no capability for surgery. So they had to talk to the husband and say that this is it. And I couldn't describe what I felt.
Helpless.
Helpless.
She was part of Henry Ford's first push to recruit Filipino nurses. Jarek arrived during the hospital's most recent efforts.
I was interviewed February of 2022. I was issued a visa, an immigrant visa.
In March.
In March 2023.
It has been decades since the U.S. passed major immigration reform. Today, delays in processing work visas and narrow limitations on the number of visas allowed means of the 400 nurses currently in Henry Ford's pipeline, only 25 have arrived.
Wow. So this hospital is planning on hiring 400 foreign nurses. 400 foreign nurses. And you wonder why. Like, because for most nurses that I've talked to several nurses, and they say that the staffing issues and the conditions are very difficult for nurses. So it is understandable why most immigrants will be willing to do that and, to work under such conditions, because will definitely be earning more than you'll be earning in your country, and it's a much bigger opportunity for you. So is there really a nursing shortage, or the issue is the hospital? Now let's just watch like one more minute of this, and then we're gonna look at another perspective from the nurses. Let's continue.
Really looking at a 2 to 3 year process right now. So that's a little bit frustrating, disheartening to some of those team members. I think it's amazing to me that so many of them have stuck with us.
He projects another 36 recruited nurses will join the health system by the end of the year, and adds if everyone they've hired in the Philippines were here and working, their shortage would be cut by more than a third.
If there's not enough personnel available to take care, the quality care will not be there.
Henry.
Okay, let me just stop the video there. We might come back to it, but let's look at now the nurse's perspective. Now, the Filipino nurse you just saw said that the staffing issues. So you wonder why? Why would this American hospital be waiting for nurses from Philippines when I'm pretty sure there are thousands of nurses right here in America? Why not just hire the Americans? Or what's happening with the American nurses? Why do they have to wait and be understaffed waiting for Filipino nurses? Nothing against Filipinos, just an observation, but it just shows what really happens in American hospitals. It is a business. It is a business. They're more concerned with profits, and you will see in this video. And as we watch, please like and subscribe.
They call you an asshole.
Been called a bitch 1,000 times.
A cunt, a knocked up whore. Get the F out of his effing room, you effing N-word. I've been bitten, choked, punched in the mouth. I had a guy try to kick me in my stomach while I was pregnant.
That poor nurse at your bedside has probably been through hell with the last 10 or 15 hours, and then you come in demanding ESPN? Are you kidding me?
And it's like, well, yeah, I got punched in the head tonight. And any other job would be like, what are you talking about?
Okay, so background, this was a video from 3 years ago, 3 or 4 years ago, but this was around the height of the pandemic, like COVID was still a big thing. So it does show really what's really happens behind the sidelines, in the sidelines with actual nurses, the situations they face, and it answers the question that we are dealing with now, why there's staffing shortages and why nurses are leaving the profession. Let's continue.
2 years into the pandemic, COVID is surging. America's frontline nurses are overworked, burnt out, and quitting in droves.
The H is for hospital, not hotel. Treat me with respect.
As Omicron pushes hospitals to the brink, America is facing a national nursing shortage. But it's not patient abuse that is ultimately driving the crisis.
I literally don't even want to be a nurse anymore. Like, this shit f***ing sucks.
It's not emotional trauma.
I hate my job, and I don't want to go back.
It's not even COVID.
I cannot do this anymore.
The biggest force that's driving nurses away? Greedy hospitals.
I could no longer work in critical care.
under the conditions I was being forced to work under with poor staffing. And that's when I left.
To maximize profits, American hospitals have been intentionally understaffing nurses for decades, long before the pandemic. What the hospital industry doesn't want you to know is that there's never been more licensed nurses in America. Hospitals just aren't hiring them.
There's not a shortage of nurses, there's just a shortage of nurses willing to work under those conditions.
If you don't have enough nurses, patients will die. They will become sicker and they will die.
Yeah, they just said it. You heard it straight from a nurse saying that there is no shortage of nurses. It is a shortage of nurses willing to work under the conditions. And that is why many hospitals are now in panic mode over this immigration crackdown, because now they feel they won't be able to bring in nurses from around the world who would be willing to tolerate working in worse conditions. But let's continue.
If you're in the hospital, your chances of dying go up by 7% for every additional patient your nurse has to care for.
If you push me past my limit, past my capacity of being able to multitask, something's going to get missed. And when I say something, I'm talking about your mother. I'm talking about your father. I'm talking about your husband and your wife.
There have been many instances where patients that die that shouldn't have died. I know that unequivocally. Families, they feel like you've done the best job that you can. And the reality is we're not.
I could not get into her room for over 2 hours. When I did get into the room, she had tears in her eyes. She was crying and holding on to me. And when I looked in her bed, she was soiled in urine. I felt like I did a bad job. I felt less than the nurse that I know I am. And I started to cry all the way home. Can I make another shift? Can I do this again tomorrow, get in my car and drive here and do this again?
The system was already broken. COVID has just made it way worse.
In one 12-hour shift, we had 6 patients die under the age of 50. And as quickly as they got those beds cleaned, there was more patients there.
A patient grabbed my hand and he begged me to not let him die. I'm sorry. And I told him that we would do everything we could within our power. And I felt like I was ready to fall apart, but I couldn't because the patient in the next room needed me.
You can clearly see that these nurses are traumatized. So on top of handling working in very harsh conditions, you have to deal with the trauma. I don't think the hospital is going to be paying for counseling. I don't think that, because this is America. Like, you handle your mental health whichever way you want. So maybe that's why we are being bombarded by BetterHelp. What's the name of that therapy company? Always putting adverts, BetterHelp, like the Uber of therapy companies. But you can see the nurses are super traumatized, lots of stress. The pay does not match the work that they're doing. It is an intense field, and many are just walking out. Many are retiring, many are leaving, and the hospitals now are being forced to hire, from abroad, nurses from abroad. But at the same time now, there is the issue of immigration. So it is like we are looking at a shortage coming very soon. Let's continue.
To understand how the situation became so desperate, you have to remember that hospitals are just like any other business. Staffing takes up about half the budget, so a smaller workforce means bigger profits.
Hospitals use this type of what they call flex staffing. So they flex for just the bare minimum at that hour of the day. And then 3 hours goes by, there's many more patients, and then it's, you have this many nurses, you'll have to just make do.
The most annoying thing that was ever said to me in my career by an administrator was, "We know you guys need nurses, but it's not in the budget."
Yeah, we know you guys need nurses, but it's not in the budget. That's really how it is. Like, that's the reality. Let's go back to this original video, 1 minute, and see how the nurses from Philippines are doing, and see what's their plan, really. What's their plan? How are they gonna face this nursing shortage due to immigration policies, in quotes, according to them? Let's see.
Ford is part of a larger group trying to address this issue through legislation that would funnel 25,000 of the necessary employment-based visas to nurses. The bill has been introduced and reintroduced several times since the pandemic.
And despite bipartisan support, we haven't seen one of those be passed into law.
The latest effort, introduced by Democratic Senator Dick Durbin in 2023.
We have medical professionals who want to come to the United States. We have shortages of medical professionals in hospitals and clinics all over the country. It's in our best interest, in the nation's best interest, and in the best interest of the individuals to give them that chance.
And co-sponsored by 10 Republicans, including Senator Tom Tillis. The bill did not make it out of committee and has not been reintroduced since.
So people need to wake up to merit-based immigration, to guest worker programs, because it's one of the single greatest benefits to our economy when we get people back to work.
Those against expanding the work visa program often say the healthcare industry should instead focus on improving the recruitment and retention of U.S.-born nurses. Foreign-born workers are undeniably woven into the labor force overall. A recent report found immigrants make up, on average, at least 10% of all workers in every major industry. In healthcare, it's roughly 17%.
We've got to expand the pipeline if we really want to solve the problem.
In the spirit of your perseverance, this administration hasn't been shy on their crackdown on immigration. Is there any reason to believe that this problem, the shortage itself, will get worse before it gets any better?
I tend to be hopeful, right? I think that if we're continuing to do the right things then and continuing to partner with our colleagues in other healthcare systems, that there are solutions that are out there.
Yeah, so that's their plan. Their plan is to introduce bills that will help bring 25,000 expedite 25,000 visas to bring more foreign nurses. Well, at the same time, the nurses currently working are quitting. Some are not even joining the field after all. So the fix is right in front of them. The fix is right in front of them. If they wanted to do the right thing, they would just treat the nurses nicely. They would be listening to the actual nurses, telling them their concerns. If a nurse tells you there is a problem with staffing, then staff correctly. Don't start going abroad and all these things. But that's how they're running. America is a for-profit for healthcare. You can even see in the comments, it's all for profit. There is no shortage of nurses. Hospitals are part of the problem. Profits over patients. So that's it. It's going to continue this cycle. It's going to continue. And there is no end in sight. No end in sight. Just have to deal with it. So if you like this video, please like and subscribe. And of course, share this on all the networks. I will see you next time.
Oh my goodness, all the networks. Wow. All the networks.